Hi guys! So, naputol siya. Actually, we had already discussed this, the core care cure. Naputol siya kasi something sa cellphone. I don't know why. So, we will going to continue. Okay, this is the sixth theory that we will be discussing. The Joyce Travelbee theory, the human-to-human relationship model. Okay, presented her theory in her book, International Aspect of Nursing, died at the young age in 1973. So, unsay goal ni Joyce Travelbee? Iyang goal is to assist an individual, family, or community to prevent or cope with the experience of illness and suffering. And the ultimate goal is the presence of hope. And she proposed that nursing was accomplished through human-to-human relationships. Original encounter is original encounter, we have emerging identities, developing feelings of empathy, sympathy, and nurse-patient attain rapport. Okay, now let's focus here. Miss, unsay kalahian ng empathy o sympathy? When you say empathy, you are putting yourself to a patient condition. O kagibutang nimo imuhang sitwasyon sa sitwasyon sa imuhang pasyente. That's empathy. You are internalizing, okay? When it's sympathy naman, it's like you're just caring your patient. Naluoy lang ka because she or he is experiencing something huge o sa ilang health, naidako nga problema sa ilang health. That's sympathy. Nakisimpatiya ka. But we say empathy is much more deeper, okay? Like you are putting yourself to their condition, to their situation, okay? That's how you differentiate the two in our own vernacular language. And Travelbee emphasizes on caring stressed on empathy, sympathy. Okay, yun yung difference ng dalawa. Rapport is like you are establishing trust. Okay? Nag-establish kag trust sa imuhang patient. Kasi you cannot let your patient cooperate pag wala siya trust sa imuha as a nurse. Okay? That's why you really have to be firm with your statement. Like, kung moingon ka nga, mawali ko, baliki yun imong pasyente. Kaya mawalaan gina siya trust sa imuha. But unless if you have dealing with some emergency problem, wala nimo siya nabalikan kasi may busy ka, di ba? So you gotta explain it towards to your patient. I know maintindihan lang yun pa sa Tagalog. You are going to understand your situation. Emotional aspect of nursing, and you really have to develop this, okay, according to Joyce Travelbee. Compassionate, okay, you have that compassion in your heart, central to holistic nursing care. I've already watched your videos, and most of you guys have answered na I chose nursing because this is closest to my heart. I chose nursing because this is what I am dreaming since I was young. Yun yung mga reason yun. And I hope that you will really develop compassionate care towards to your patient. So, dili lang dali lang yung singgit-singgitan yung pasyente just because your patient came from a, marginalized sector of the community, iyoharan siya ng singgit-singgitan, dapat dili nga. As a nurse, you really have to develop this compassionate care, and you really have to assist the patient, sick or well, regardless of their origin, kung dato ba na sila o pobre. Kasi nga, when I am working in a hospital, napod na tayo mga kauban na ingana, okay? But you really have to be reminded na you have to treat your patient equally. Walay favoritism, walay pinalapit. That's it. And the next one will be Catherine A. Barnard, which talk about child health assessment. Recognized as a pioneer of mental health nursing. So she is the pioneer, and can you still remember that the mother of psychiatric nursing? Of course. Ito, siya naman yung mental health, the pioneer of mental health nursing, a renowned teacher, researcher, and innovator. Her theory focused on the mother-infant interaction with the environment. Her theory remained population specific. Miss, why do you say that theory of Barnard is population specific? Of course, iyahang dili wide iyang scope. Ang iyang theory primarily focuses on the mother and infant interaction. Okay, that is why this is called as a population-specific theory. Okay, next would be Evelyn Adam, conceptual model for nursing, wherein she uses a model that she learned from Dorothy Johnson. Includes the goal of the profession, role of the professional, and the intervention of the professionals. Some of the terms here, guys, are self-explanatory. So, means, wala mo discuss isa-isa. Because, guys, it's self-explanatory. I know you can understand those topics. So, I am just here to guide you and to give you some brief information about this. And do not worry, because as far as what I've mentioned a while ago, we'll be discussing this following theories more deeper, okay? More deep, like that, in the subsequent lectures nato. Okay, next will be Nancy Rupert, Winifred Logan, Alison Tierney, which they are the one who formulate a model for nursing based on a model of living. So, produce a simple theory which help bedside nurses. So, who are the bedside nurses? Of course, those nurses working in a hospital. Sila to mga bedside nurses. Mga private duty nurse, ganyan. Nancy Rupert is the first one who formulated theory. Okay, siya jud ang nag-formulate. But during the fourth revision of the book called The Elements of Nursing, the three of them collaborated. Si Rupert, si Logan, and si Tierney. Sila itong nag-collaborate during the fourth revision of the book of Rupert. So the 5 main factors that influence the activities of daily living is biological, psychological, talks about the mental aspect, okay, sociocultural, environmental, and politico-economic. So those are the 5 main factors that primarily affected or influenced the activities of daily living of our patients. The last but not the least is Ida Jean Orlando Pelletier, which talks about the nursing process theory. Okay guys, kabalo ba mo na this theory of Orlando or Ida Jean Orlando, mao ni siyang pinakasikat or siya ay si pinaka-importante sa ato ang professions. So when you go pag ano na mo, for example, you will become a nurse in the future and then you will go and utilize nursing process. Magamit gihapon ninyo na theory, magamit gihapon ninyo ni na practice. Okay, do not forget this. So develop her theory during her study in Yale University. This study is carried out by observing and participating in experiences with patient nurses, students, and instructors. So, ang kang Ida Jean Orlando, dili lang sa isa ka population siya nag-observe. Dili lang sa isa ka population siya nag-study. Yung sa studyhan po niya ang patient, nurses, students, and instructors. That's why she come up with this theory. So her work contributed to the development of nurse-patient relationship. Her nursing theory stressed the reciprocal relationship. Okay, this is the term here. Reciprocal. We say reciprocal relationship. It's like give and take relationship. Okay, you are not just a nurse to the patient, but you also need to listen your patient sa may mga kaligot-gut sa imong patient, because you are having a reciprocal relationship. You cannot achieve your goal if you alone are the one who perform everything. That's why you need a patient idea. You need to collaborate with your patient. You need to collaborate with the loved ones of your patient. Okay? Patient experience distress or feeling of helplessness when their needs are unmet. So, there are chances na dito natin i-discuss. There are chances here that during this phase, dira niyo ma-identify kung ang needs sa imong patient met ba, partially met, or unmet. But of course, I would not confuse you with this topic. There are 5 steps of nursing process, and I want you guys to remember this mnemonics, okay? So, maugin na yung timan-an bisag asa pa mo moabot, mo transfer mo school, or I hope so, dili. Mag second year, third year, and even fourth year, and even when you're becoming a nurse already, you have to remember the 5 steps of nursing process. When you say steps, siyempre self-explanatory, dili na siya pwede magkabaliktad-baliktad, dili pwede maunang evaluation, maunang planning. No. You have to remember our mnemonics. It's add pi. Okay? Add pi, since A stands for assessment, D stands for diagnosis, P stands for planning, I stands for implementation, and lastly, E stands for evaluation. So in this phase sa evaluation, dira na to mabalaan kung ang ato ang gipanghimo sa atong patients are met, partially met, or unmet. But of course, we will not tackle this topic kasi it's a long topic, guys, and we need an hour or even more than an hour to discuss the topic about IDG Orlando. But do not worry because we will be discussing these steps of nursing process um, in the near future. But for now, I want you guys to memorize the mnemonics for the 5 steps of nursing process. Add by, add by, add by. So don't forget those mnemonics. Assessment, diagnosis, planning, implementation, and evaluation. Okay? So that would be all for today, guys. And I hope you learned something for today. And I will be posting this lecture in YouTube for you guys to recall the topic, recall the lecture as much as you want. But of course, you're gonna watch this as soon as I posted it or during our time period so that it would be easier for you guys to answer our future quizzes and examination. Okay, this is Miss Rhea again. Thank you guys for listening and have a blessed day.